When I first came here, I could not tell you what public health was. In my first public health class, I learned that public health is everything. And I love answers like that because I'm like, okay, that means I'm not put in a box.
Public health is the study of health at a population level, whereas medicine looks at health at an individual level. Somebody comes in, they're already sick, they're already injured, and you help them in that moment. Public health looks at ways to prevent people from getting sick or injured in the first place, or help them get back into society and live a healthy life.
When I first came in, what drew me to public health was that I didn't actually know that that was something that you can major in. And so I came in as pre-physical therapy and pretty quickly realized that that wasn't what I wanted to do. So I talked to Dr. Wegman-Geedy, and she told me that everything that I had enjoyed was public health.
Public health fits perfectly into the liberal arts model because public health itself is interdisciplinary. You need to know information from the sciences, you need to know information from the social sciences. How does somebody go and live in society? How is their health impacted by the world around them? We also need the humanities in public health when we think about things like health literacy and how do we communicate effectively. There's so many careers in public health. You can actually get an entry-level position in many different types of fields right after undergraduate, and that's something we're very proud of here at Augustana, that students who are interested in grad school are very successful, but you don't have to go do more school right away to be a public health practitioner.
Over the summer, I interned at the American Dental Education Association in Washington, D.C. A lot of the work that I did revolved around outreach to the public, working with diverse communities, and I just really thought this is really tying back into a lot of the coursework that I did.
So last summer I interned at Noaks Ark in Stockholm, Sweden. What they do is they provide community support for people living with HIV. And then one of my big projects was I actually was helping them apply for a grant so that they could do research on self-testing and self-sampling for HIV.
Who would be a good fit for a public health major? Students who are curious, who want to help people or help the world, students who like to think about complex problems and how to digest them and explain them, students who like to help connect people with resources. These are who make great public health majors.